Today is Friday, January the 29th, 2021. This is Speak On It. My name is Malik. Today we will travel down memory lane for the most part in order to put a little emphasis on the Westside Heroin Opioid Task Force and to help people see very visually, very graphically, why the Westside Heroin Opioid Task Force work is very important. Some of the images you see will be disturbing to some of you, and some of you will not be able to stomach it because it will make you want to vomit. But it's the reality that's in our neighborhood, some of them. It's an epidemic that was existing before the pandemic. And now when you join the two, you got a real serious situation here. So today we want to just review some of the work that the Westside Heroin Opioid Task Force has been doing through some of the conversations with some of the partners. We're not going to spend a lot of time on either one of these clips because each clip is probably a whole show. Matter of fact, I know they are. So we're going to just go to a point because we want you to understand about Narcan. We want you to understand that you can, I guess today, since you really don't call people, you can Google the Westside Heroin Opioid Task Force, a task force created a few years ago by State Rep. LaShawn Ford to address some of the substance abuse issues in his district, the 8th district, if I'm correct. So without further ado, let's just get started with this piece here with one of the partners and listen to what she got to say because they've been dealing with recovery for a long time. And as we go down this memory lane, feel the pain. All right, brother. To speak on it, you already know. It's a live interactive opportunity for you to call in here and speak on the issues. You see the phone number right there, 312-738-1060. Now, we know you at work, you ain't got off yet. But what we're hoping is that maybe whenever you're in the house or whatever, you might be sitting around during the week and you see it. Whatever it takes for you to get the information. Tonight is a continuation of our effort to bring about awareness of the activity that State Rep. LaShawn Ford and others have put together called Westside Heroin Opioid Task Force. But it ain't just on the west side. That's why I'm hesitating. Today we have a guest. You know, last week we had a guest, and tonight we got a guest. The guest tonight, I like her. I like her energy. She made it clear. She called me and said, "Look here, I ain't that particular about woo woo." She got here. She had a little coat on, and she got some tats. She said, "I don't know woo woo woo." And then demonstrate. Let them know that you stand on what you do. So she got all her kit here, and we've been talking about what you call it, Narcan.
Narcan, also called naloxone, which is the generic version.
All right, now, so what we're going to do is this. We told you this medication will resurrect you from the dead. So she's going to tell us all you need to know if you have someone in your family or whatever that need assistance. So that's where we're going with this. So I want you to pay attention. This allows you to see how to do it. Tell folks who you are, tell them what you do, and then tell them what they need to do. Glad you're here.
Thank you. Thanks for having me.
Mm-hmm.
So my name's Ileana Espinosa, and I work for the Chicago Recovery Alliance. So we are one of the oldest and largest harm reduction programs in the country, and we were the first people to start overdose prevention education and naloxone distribution in the world to lay people.
In the world.
So in the world, we were the first people to start doing this. We started doing it in '96.
Okay.
Before there was even infrastructure in the state or in our country to like support this kind of effort. But this was actually a medication that's been around many years.
Okay.
So medical professionals have had access to this since '71, which is when it was approved by the FDA. And we started distributing it to everyday people, particularly to people who were actively using drugs and family members and friends of people who were using drugs, who were the people who were obviously directly impacted and the folks most likely to be
Keep talking.
there
Hold up
in
one
the
of them
event.
bottles so these folks can see.
All right, so it looks like, like this.
That's
Looks
good.
like this. There's also a common nasal version, which is being marketed as, so the brand name is Narcan. Looks like this, so a lot of folks have seen this version. And it comes in the form of a nasal spray. It's most likely what you would access at a pharmacy. But then we give out the generic version, which is the same medication, but it's called naloxone, so a little harder to say. And it comes in a liquid version here in these little vials that are pre-measured, so one bottle is one dose. And so the version we give out is the intramuscular version. So people would have to load it up into the syringe and then inject the person in a muscle, similar to like a vaccine. So it's the same idea, or like an insulin shot, although those tend to be subcutaneous injections. So let me back up a little bit. So CRA, I'm just going to say a little bit more about CRA. So we are a nonprofit that's been around since '91, actively working to reduce drug-related harms among people who are actively using drugs. So we're not a drug rehab program, although we do many, many referrals into treatment, but when the person is ready. So we focus on reducing drug-related harms by giving people access to new and clean equipment. So we give out syringes to people who inject drugs, and that's one
Say
way.
that again. You give out.
We give out syringes to people who inject drugs, and we give out
That's
materials.
these things here?
Well, these are for muscle injections. We
Oh,
give
okay.
different kinds of syringes for people who are injecting in the vein because these would
okay.
be too large for that. But we give those out, and we give out materials for people who snort drugs, people who smoke drugs, both as an engagement tool, but also as a way to talk to people about reducing risks related to HIV and hepatitis C transmission, to get people linked up in care and treatment if they're interested on their timeline, and to talk to people first and foremost about overdose. Because there are treatment programs, which are great, but those are all abstinence focused. So what happens to all of the people that aren't ready for abstinence? They come to us. And so we meet people where they're at in their drug use, and we talk about supporting any positive change as a person defines it for themselves. So that's our mission. And we're an organizational member of the Westside Heroin Task Force. And a lot of what we do in our work, in addition to direct service and some research and advocacy, is we do training and technical assistance on overdose prevention. So we train anyone and everyone freely, and we give out this medication freely. So just to give an idea of our scale, in 2018, we distributed 80,000 doses. So 80,000 of these little vials locally. Much of that went to the West Side, which is where
Hold this
much of
up
our
again.
outreach
That
is.
little thing there? You gave out
80,000 doses of this prescription medication, which in the state of Illinois, you do not need a prescription to have or to use on someone. So 80,000 doses. In 2019, we're anticipating that number will be closer to 100,000. And this is all medication that's going free to people. And we prioritize getting it into the hands of people actively using drugs, because they're the folks not only most likely to overdose, but most likely to be there when an overdose occurs. So we definitely want social workers to have it. We want nurses. We want family members and friends. But if people who are using opioids regularly don't have access to this, what's the point?
Yeah, and that's a hell of a question. What's the point? Now, you telling me y'all been in business since 1971.
1991. 1991, and have been distributing this medication since '96.
And you all, and a lot of it's been on the West Side, has given out 80, can I touch this here?
Yes, sir.
Hell, I ain't trying to be resurrected, but anyhow. Look at here. You see this here? 80,000 dosages to somebody right here on the West Side and the South Side of Chicago.
Citywide.
Citywide.
But our offices, so we have 2 offices. One is in Englewood, that was our first office, and the other one is in North Lawndale.
Okay.
But we mostly operate on a van, on a silver van, so most of our services are mobile, and we do sites 7 days a week. Almost every day of the year, we're out there on a set schedule, and people can look up our outreach sites on our website, which is anypositivechange.org, and our whole schedule is there. So our services are all free, they're all anonymous, and we try to make them as low barrier as possible so folks feel they don't feel judged. So we are reducing barriers related to stigma and access. So yeah, if you or anyone who needs this or wants to be trained, please come chat with us, and I can do a demo. Would you like a demo?
Yeah, as long as you don't knock me out this chair.
Well, I can practice on this.
Okay.
So this is a pretend muscle pad. Should I put it? I don't know. Should I
Yeah,
put it
that's
here?
cool.
Okay.
Just do you.
All right. So when using the naloxone, and I'll say one other thing is. If you come to CRA and get a naloxone kit, the way that we package them is because this is a prescription medication that is temperature and light sensitive. So it's recommended that it be stored at room temperature, out of direct light, which is why we put them in these non-translucent baggies. So we pack them up. So you just throw in the little vials and you throw in the 3 syringes, and they just go in like this. And I forgot to bring one of our little outreach cards, but we often put our outreach cards in here as well so folks know where to get more and how to access services. And then you just zip it up, and it's like a little Ziploc bag. I'm having trouble right now.
No, that's okay.
There you go.
They get it.
And then it's nice and discreet. I've traveled with this on airplanes in my carry-on or in checked baggage, although different states have different laws related to naloxone. We in Illinois are lucky to have some pretty good laws that support everyday non-medical lay people carrying this, using it on someone. So basically I'll say what we have right now is a law that was passed in 2010 called the Drug Overdose Prevention Program Law. I think I'm saying that right. Yeah, so in 2010 that came about, and it basically allowed us to do third-party prescribing. So we do have like a medical director, but all of us staff, including myself, are not medically trained. And so what it allows us to do is to go out and to educate anyone, any community member who would like to learn, any professional, whoever, how to use this medication, how to recognize signs and symptoms of an overdose, and then once we've educated the person, we can then distribute this prescription medication without a prescription to the person. And in addition, once someone is trained, according to state law, anyone who's just like walking down the street or knows someone who has OD'd, if you suspect that someone is ODing, you are covered from all liability according to the law by using this medication on the person in attempts of saving their life. And the reason is, one, because it is such a public health crisis, that so many people are dying. More people are dying now from drug-related deaths than of gun violence, and that's true in Chicago, and that's true nationally, which people are not talking about. In 2017, there were 650 gun-related deaths in our city, which is unacceptable and an awful number. But in comparison, we had closer to almost 800 overdose deaths, drug-related overdose deaths in the same year. And that's not getting as much attention. So overdose deaths are preventable, and we're seeing way too many people die of drug-related deaths. Chicago's rate is is more than 2 times greater than the national rate. And we know that in our city, our demographics are reflecting disproportionate rates among people of color, particularly with a really high burden on older African-American men. As people age, they don't metabolize drugs the same, and so age becomes a risk factor. But nationally, it's a different demographic, right? It's more Caucasian folks, it's more rural folks, it's younger men. And it's a lot more prescription pill related overdoses. In our city, the majority of overdoses are occurring from fentanyl and heroin, so illicit opioids, not prescription pills. So it's a different narrative that I think gets a little less attention in the media. So I think that's important to name. I think I went off on a tangent and I forgot what I was
you
gonna
did
say.
just right. See,
Should we show how it works?
yeah.
All right.
Let's see it. Whoa.
Go ahead.
This thing here.
Yes.
This package. They get all of that?
Yeah, so every person that comes through to us gets a kit, so they get 3 doses, they don't just get 1. So our 80,000 doses translates into about 25,000 kits that were distributed. That was just in 2018.
So that's 3 different people.
No, this is for one person.
They need
So we
3
never-
hits.
So it's hard to know. So there are a lot of factors involved when a
Okay.
person overdoses, but right now, because of fentanyl is 50 to 100 times more potent than morphine. And so what we know is that overdoses are happening faster and they're more intense. And so the need to respond quicker is just that much more important. And so we never want to only give a person one dose because they might need more than one. So we always give people 3 doses so they have extra. We recommend starting with 1 vial, which is 1 dose, and waiting 2 minutes before giving a second dose because it usually takes about 2 to 3 minutes for the, I'm sorry, Spit, for the first one to kick in. Yes. And the other thing I'll add that's really important to know is that people who are overdosing cannot anticipate their own overdose. And so if they are alone, they cannot use naloxone on themselves.
And see, that's interesting. And I didn't mean to cut.
No.
But what's his, LaShawn Ford always said it. I'm trying to figure out why he say that. He say, don't be alone when you do dope. And I'm trying to figure out what dude talking about.
He was trained well. Yes, he's absolutely right.
Don't do it by yourself.
Don't do it by yourself. Have a buddy system. That's actually a really great way of reducing harm. People have lots of good reasons for using alone because of stigma, because of burnt bridges, because literally their behavior of using drugs is criminalized. And so people have lots of good reasons for hiding in the shadows, but it puts them at incredible risk of death and disease. And so trying to encourage people to have a buddy system or leave the door propped. Let someone know, hey, can you check on me in a few minutes? If they can't do any of those, making sure that they leave the kit out in the open and that people that might know them know how to use it. So they're training people.
In there and you see them laying there foaming, then you know the kit is probably what's needed at this point.
Yeah.
Now, see, you all need to understand this here. I'm glad she's here because she's making a claim. She talk fast, and that's good. That's why y'all got to pay attention. But this information here, we've had these shows, we had people talking about it, but we needed someone, and when I first saw her do it, I was talking to Don Du from HSI, and he said, you really need to get her on the show. So I made a note, and then Mr. Lee Rush, I think he followed up, and here you are. And I think one of the reasons Don Du said it was that he knew that with the West Side, street level people, he know we needed somebody to be able to talk about this here that went all stiff. You know how some people be sitting up looking all crazy in hell? No. She sound like she could walk up to me. And I'll give her some props. And that's what we need. We need somebody that can communicate how you use this that feel like they got street cred. That don't mean they was a abuser. It just means that they understand the energy and they ain't scared. A lot of people that do this scared, but their fear turns people off. Now tell me about that thing they blow in their nose. I mean, woo-woo. Y'all got any of that?
So this is the same medication. It's a spray in the nose. The reason we don't have this one is because it's cost prohibitive. So out of pocket costs, it's about $150 for 2 doses. There's no way we could distribute 80,000 doses free to people if we had to pay that much. So this version though is available. So they've started giving this out to people in Cook County Jail who are being flagged as exiting because the number 1 cause of death for people experiencing incarceration and experiencing homelessness is overdose. It's the number 1 cause of death. So Cook County Jail has done right by starting to hand this out to people who've been flagged when they've come through the system, which is good. But I think they're giving out the nasal version. Also, there's a standing order in the state, which means that in theory, anyone anywhere in the state of Illinois can go to their local pharmacy and request naloxone over the counter, bill their insurance. That's how it would work. So depending on the insurance you have, there would be probably some low-level copay. Medicaid covers it 100%, and there are refills. And you're likely, if you're getting it from a pharmacy, to get the nasal version, but it's just very expensive. The nonprofit rate is $75 for 2 doses, still very, very expensive. And then we have this other version called the Evzio, which I call Narcan for the 1%, because it's thousands of dollars. It's basically the EpiPen, so it's an auto-injector. But I don't like to...
Now, let me say this. That's a whole show. That's a whole program. So we could run the whole program, but we're not doing that today. Periodically we might. But I guess I can say this here. If you want to see the whole show, all you got to do is just go to Dr. Kofi Malik on YouTube, and you can see these shows. Most of the shows, not most of the shows on CAN TV are actually on YouTube. So you can go to Dr. Kofi Malik or CAN TV Nonprofit Services, and you can see this show and other shows that we have done. Now, the next piece here will be in the same direction of this. It'll be the other piece with the outreach workers from the Westside Heroin Opioid Task Force working over there with Lucius. And this is a piece that goes hand in glove with what you just saw. And it's a program, too, that you can go see. But we are using these shows today because, we want to be clear that this is the first of the year, and we're going to use a piece of this. We ain't going to be using everything. We're doing it in collaboration with the Austin Voice. So just pay attention, and we'll be on to something else directly. Oh, Omar, you probably need to cut this off because of the music. YouTube gonna probably be clowning. Let's just go on to the next piece with those people, because I'm tired of these YouTube people messing up my stuff, talking about these people's damn music. They don't want you to use it. They shouldn't put this stuff out in the public way. Nobody trying to make no money off your damn music. But let's go on, man. Let's show these pieces and we'll move on to something else.
Do not smoke K2. This kid is suffering from the results of smoking K2, which is a synthetic drug. It looks like marijuana, but it's not marijuana. Some say it kind of smells like marijuana, but no, it's synthetic. It's made up. It's not from the sun, the moon, the earth. It's not from God, and it doesn't grow naturally. This psychoactive substance is sometimes called Kush or spice. It's very dangerous. If your friends come in contact with it or anybody that you know, I advise that you stay clear from it. It's not going to benefit you in any type of way. It's not going to make you cool. It's not going to give you more swag. It's not going to give you more girlfriends or make you more of a gangster or anything like that. It's probably will have you laid out like this dude right here who's missing school with his book bag on his back because he can't think and act right. He's probably hallucinating. He's paranoid, and he has an altered perception. He's delusional right now. He doesn't even know what life is. It's dangerous to the brain. Doctors don't even know what the long-term effect is going to be yet, but it's probably going to be a lot worse than this. A lot of people result in violent behavior. Some have heart attacks, their first or second puff. Some people have suicidal tendencies. A lot of people start vomiting, but one thing's for sure, it's very addictive. They say once you get on this, and if you do it for a couple weeks, you can't get off. If you try to get off, you're throwing up, you're sick, you don't feel normal, you can't function right. They say it's nearly impossible. It's almost like crackheads trying to get off of crack. Don't mess with K2.
That's that K2 shit, bro.
In 2010, 11,000 people were admitted into the hospital, and it's only increased since then. New York alone had 8,000 people between 2015 and 2016, and is currently going higher and higher as far as the people that are suffering as a result of abusing K2. It causes severe long-term depression, irritableness, a bad attitude, and confusion. A lot of people have went off and killed other people, not knowing, because they were under the influence of K2. This guy is about to roll on out in the street and run over. So this man is saving his life. People don't know what to do when people get on this K2. Some become very animalistic and zombie-like. Just leave it alone. Don't even contemplate it. I don't care if you heard the song about Lil Wayne saying, "We smoke that Kush, we smoke." You've seen Lil Wayne lately. He doesn't look like himself. That's all I gotta say. Hashtag official tribe of Judah.
Now, that's one. And there's a couple other pieces. I just want you to look at them and look at the pattern. Look at how these people are acting. These are people
In the
just
fucking
like
rain.
your
Don't you
family
swim.
members or even you.
Crazy. Possessed. You gonna be sick. Oh, what up, man?
What's up?
Hey, I like this. I like your outfit too. Yeah, that's crazy. It's crazy out here in New York City, man. Yo, yeah, baby, you ain't swimming. You bleeding and all that shit, man. I'll call an ambulance for you. You hear me? Hey. 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 You hear me? Look at your arm. Damn. Oh, banging my head. That's crazy. What the fuck you took, man? What the fuck you took? That's crazy. Oh shit. Oh. Yo, do it look like she alright, man? I don't know her, nigga. You can help her like I'm trying to help her. I call an ambulance, that's enough. I'm not about to touch her.
Help me!
Overdose, nigga. She overdosed or some shit. Ambulance on their way.
Help me!
You got help on the way. Shit, that's crazy. You got doodle on your arms? Oh, you dead. God damn, man. Oh, woke up again. Woke up again. Oh, damn. Soaking wet. There go the ambulance right here. I think this is for you. Hey, yo.
Now,
This is for you.
let me say this. There's a little more of that to be seen, but like I said, you can find it. Now, the West Side Heroin Opioid Task Force, like I stated, was created by LaShawn Ford. Now, that piece there was out of New York. You're going to see this piece that's coming is from Philadelphia. Then there's a piece out of Chicago. Now, something you need to understand is this. When LaShawn Ford gave me and Brad Cummins the idea of being involved in bringing about media outreach, he said, you know, Malik, I want you to do what you do. Now other folks say, well, what can he contribute? Who is he? You know how niggas are. You know what I mean? Everybody want to think they the one that know every damn thing. But see, Ford knew that I am that type of dude that will see this here. And I will show you this here. Because I want you to feel how real the pain is. Because I know this is in your family. If it's not you. You understand? But all of you so-called thank you professionals that want to sanitize stuff, you're missing it. You got to have it raw. Sometime naked. Sometime nasty. So when you look at this, you feeling something. So don't get it twisted. We do all type of programs, but this is media outreach for the West Side Heroin Opioid Task Force because all of those drugs feed into each other. You understand? And when those drugs feed in each other, it's like the little boy with his book bag. It smelled like marijuana. It looked like marijuana. But it was what? E2. But he's acting just like the woman, just like the man, just like these zombies. Continue, brother. Now, see, that's some of that heroin dope there. I would think that's some of that dope. You can almost tell a heroin addict. Boy, they be like a damn rubber band. They go all the way down and bounce back. But they got some stuff out here now. It'll make you fall and bust your head. Your brains will be all over the doggone street because it's been mixed with some stuff. That fentanyl just let you kill yourself. Now watch this dude here try to be a dolphin. This is Chicago right here.
Some Joe on the mic. Yeah. He high as hell.
Damn. Come check on your peoples, whoever.
What? Ass nigga.
He acting crazy.
You just acting like a fish, shorty.
Lord. Y'all, hey, somebody gotta check on their peoples, boy. Shorty. Call 911, Lord. Everybody got the... Ooh, shit. Hey, somebody, come on, let's help him, Lord. Let's help him. Hey. No, hey, I'm not fucking this stuff up.
On the real. Lord, don't hurt yourself, T.
Hey, Joe.
Put shit up, T.
This shit ain't funny, Lord. On Neil. On the fin. Man, call the ambulance, Lord.
On there, motherfucker.
On the fin.
Boring this shit, man.
Yeah. Call the ambulance. Be cool, bro. Be cool, man. Damn.
Just came from by the gas station.
Be cool. He fucking himself up.
Busting his head, he fucking other motherfucker face something over here.
Be cool. You gonna be alright. Man. Come on. Call the ambulance, man. Mama. Damn, man. You gonna be alright, bro. Be alright. Be cool. Man, I got this weed on me, man.
Put it in your pocket.
No, it's in my hand right here.
Put it in your pocket, bro.
Hold him down, bro. Don't let him.
I got you, T.
Hey, Nizzy, put this up. So I put this up.
Ain't nobody got no wood.
Man, Joe. Yeah, he fucked himself up, man. Here come the ambulance, bro. You gonna be alright, bro. Damn, man.
All right, we can
He must be off the air or something, man.
Now, let me tell you something. You know, in these pieces, you see citizens, residents reaching out to help. You understand? I want you to understand this here. So don't get caught up when you think and hear that black folks don't care about each other. These people, they saw this and they intervened to keep these people from going totally into self-destruction. People tried to help. Now, that was before the pandemic hit. So you have to understand this here. But I want to say this, and I don't need no pat on the back. I don't need no salute. And I don't need no praise. I don't need none of that. But what I need is for folks to understand. Sometimes I have to go raw. You understand? Because it's too deep to have little white boys, little Asians, little white girls, and everybody but a Negro bringing you what's real with the Negro. You understand? I am a certified, bona fide Negro. So I want you to feel what we are experiencing in our community. And I don't want no damn academic sounding kid trying to interpret and tell us what it takes to help our people. You understand that? I don't need that in my energy zone. So I come with intensity. Because in our community, it's intense. And your little prescribed way to do it, it don't work for us, y'all. People like me don't supposed to be able to know how to service those type of people. But you're going to bring some 22 or 23-year-old alien into our community and tell us what we can and we can't do with our people. You know what I'm saying? So yeah, I'm going hard. Yes, I am. And I'm going to stay going hard. Yes, I am. And that's why we had WHO as part of the Westside Heroin Opioid Task Force. We help out, be clear. Because those are some young people that are helping with the process of distributing the Austin Voice. Because in that paper, you can find the schedule of what the activities are. And you can get help, training to address some of these issues. Now, everything is everything, but ain't too much change. It was worse in 2020 than 2018. And the way it's going right now, it's going to be worse in 2021 than 2020. So I will be digging in the garbage can in the alley, in the sewer, to find even more graphic material to bring here and to bring to your house. And no, don't try to question whether or not, well, that language. Nigga, if you don't understand that language, then you ain't got no business looking at this program. That ain't profanity. That's pain. Brother, let's go on because we're running out of time. Now, we're going to just run down this. We're going to take a little thing. We're going to just run down these pictures. We ain't even deal with that. You see what's happening here? The cartels done figured out how to deal with this, and they're adapting. So what they're doing, now they pushing this meth and fentanyl. They can't get the cocaine and them other drugs in here the way they want to. So now meth, something that Negroes don't talk about a lot. That's usually just white folk. But now, you see what's happening? You see all that? These cartels, these dope businesses, they ain't letting them stop their money. And the government, particularly in Illinois, making that $1 billion a year, you know what I'm saying, selling marijuana. And now they're using marijuana and fentanyl. That's a whole different high. So what you got to understand is this here. These things are happening as the pandemic is happening. But the Westside Heroin Opioid Task Force and the Westside Health Task Force are out here trying, that's Behavior Health Task Force, trying to get people aware of services. Now this piece here, cocaine worth $26.7 million. All them designs and stuff. Once again, that's what's happening, y'all. Don't think it's going away. But this is what's happening. You sitting here, you know, in your little world, but there's a lot happening, man. And you got to know about it. And that's why we're here, to help you know about it. Now, every week we ain't going to be this intense. This piece here, nearly 300 blocks of cocaine seized by the Fed in Miami. That's a whole lot of cocaine. You understand? But ain't nothing stopped. People's getting me. On my way here this morning, between Pulaski and Springfield over there. I think it's 28 Ward. I ain't quite sure. But the truth of the matter is, it's here. And it's legal now. But hell, they were doing it like this before it was legal. Them brothers out there selling that marijuana early in the morning. Police just drive right through there. They always drove through there, so it don't matter. But they trying to get their little money on. But the government done snatched most of their money. You see? But now, we ain't going to show that today, but, that's a piece to say that marijuana
14.
It's got a very interesting role in treatment for COVID-19. Yeah, I might show that next week. So marijuana is becoming everything, and maybe they knew that when they made it legal because they know that's how they gonna get billions and trillions of dollars. And they might have knew that, the pandemic and this passing and making marijuana legal would be something that would benefit society. They say those billionaires, so many of them, they done made over $500 billion since the pandemic. That's in a year. So some folks making a lot of money off of this pain and suffering. But let's go on, brother. Let's see what we got. Let's just run through this now.
Million have fallen behind on rent, and many risk eviction. If we fail to act, there will be a wave of evictions and foreclosures in the coming months as this pandemic rages on, because there's nothing we can do to change the trajectory of the pandemic in the next several months. So look, this would overwhelm emergency shelters, increase COVID-19 infections as people have nowhere to go and can't socially distance. The American Rescue Plan asks Congress to provide rental assistance for millions of hard-hit families and tenants.
While he finding that other piece, let me just emphasize what dude just said. He said there ain't nothing we can do. Now, had the other dude said there wasn't nothing we would do, y'all be talking about crucify him. Now, it's all about politics, man. Now, he's in the seat, and he's seeing the same thing other dudes saw. And you want to say the other dudes played it down. Damn near everybody plays stuff down. You got a problem in your house. Before you tell your woman or your kid the extent of the problem, you try to soften it and hope that it get better. And that's about all dude did when he brought that the way he did. Wasn't no cover up. He just didn't try to panic you. So now this one here ain't been in office 2 weeks, and he already saying there ain't nothing we can do. This is what's going to happen. Well, this is what was going to happen anyway. You know what I'm saying? So the 400,000 people that's dead, you ain't going to be able to blame him for the next 400,000, are you? Really? Ain't a whole lot they can do. But try to do what they're doing now, get people to take the vaccine, and a lot of them getting sick, but I'm sure less going to get sick from the vaccine that's going to die without it. So, it's a balance. Now, brother, let's see what else we got connected to this pandemic thing.
And in today's briefing, we discussed 5 things. 5 things we'll do in an attempt to turn things around. 5 things to turn frustration into motivation. 5 things to help us meet our goal of 100 million shots by the end of our first 100 days in office. Some wonder if we're reaching too far for that goal. Is it achievable? It's a legitimate question to ask. Let me be clear. I'm convinced we can get it done. And this is a time to set big goals, to pursue them with courage and conviction, because the health of the nation is literally at stake. First, we will immediately work with states to open up vaccinations to more priority groups. The process of establishing priority groups is driven by science, but the problem is the implementation has been too rigid and confusing. If you were to ask most people today, they couldn't tell you who exactly is getting vaccinated. What they do know is there are tens of millions of doses of vaccine sitting unused in freezers around the country. while people who want and need the vaccine can't get it. We'll fix the problem by encouraging states to allow more people to get vaccinated beyond healthcare workers and move through those groups as quickly as they think we can. That includes anyone 65 years or older, a population that has accounted for over 80% of the deaths to date. 80% of the deaths to date. We also have to continue vaccinating frontline essential workers like educators, first responders, grocery store workers, etc. It won't mean that everyone in this group will get vaccinated immediately, as the supply is not where it needs to be. But it will mean that vaccines become available, as they become available, will reach more people who need them, will reach out and get the vaccine used. The second thing we're going to change, if we're getting more people vaccinated, then we need more vaccination sites. That's where we're going to harness the full resources of the federal government to establish thousands of community vaccination centers. On my first day in office, I'll instruct the Federal Emergency Management Agency, FEMA, to begin setting up the first of these centers. By the end of our first month in office, we will have 100 federally supported centers across the nation that will ultimately vaccinate millions of people. Think of the places that are convenient and accessible: school gymnasiums, sports stadiums, community centers. We've already had productive conversations with bipartisan groups of county officials, mayors, governors, tribal leaders, leaders of the private sector, who shared their ideas with us about this effort. And as we build them, we're going to make sure it's done equitably. We're going to make sure there are vaccination centers in communities hit hardest by the pandemic, in Black and Latino communities and rural communities as well. Within the first month of our administration, we're going to deploy mobile clinics, moving from community to community, that will partner with community health centers and local primary care doctors to offer vaccines to hard-hit and hard-to-reach communities in cities, small towns, and in rural communities. And to staff up these centers, we will mobilize thousands of clinical and non-clinical professionals. Think of the people that we deploy in natural disasters. Experts from the Federal Emergency Management Agency, from FEMA, and the Center of Disease Control, our Public Health Service Commission Corps, our military medical personnel, our first responders. Additionally, we're going to expand the pool of medical professionals, including retired healthcare workers, who can administer the vaccine and to ensure we have enough vaccinators to meet the nation's needs as we ramp this up. And as governors of both parties have asked, our administration will reimburse states 100% when their National Guard is deployed in the fight against COVID. We'll provide resources to help states cover the cost of personnel, vaccinators, administrative staff, as well as supplies like dry ice and laptops and protective equipment.
All right, that's enough.
The third change we're going to make is we're going to fully activate the pharmacies across the country.
Where the people are talking about how hard it is to get an appointment. See, can we find that piece, Omari, because, you know, things are getting better, but these people are actually telling us today, yeah, this piece right here, you need to look at this because it'll give you some information once we get through this this piece together running through here. But, you know, you have to be persistent and you have to be patient. And, you know, but if you persist,
On the Medical Watch, who
you'll
is
be all
getting
right.
the COVID vaccine and how?
Medical reporter Dina Bair has the latest tonight.
There is no one good way to tell you to make sure you get your appointment for your COVID-19 vaccine or for loved ones who are desperate for their shot. But we found dozens of people who qualified in the current Phase 1B got their slot. The key is looking to multiple resources, the county, city, and your doctor, and be prepared to try again. The cars stretched down Diversey Parkway, all in line for COVID testing. But inside Innovative Express Care on the city's north side, this is the best seat in the house.
I'm stressed. I need to get the COVID vaccine. I'm a caregiver for my mom, which is 94 years old, and I'm also a CPS employee waiting to go back into a safe environment.
For 65-year-old Vicky and 69-year-old Steve, it took a lot of persistence and a little luck to get here.
I signed up all over the place, and finally I was able to get a code to get in.
So you go and sign up, and it says, okay, pick a date. So you pick a date and a time, and everything. Every time you pick something, it says not available.
It's time-consuming, but you got to do what you got to do, I guess.
Here's the Moderna.
The fridge isn't as full this week, but Dr. Raul Kare said he expects to restock his vaccine supply by next week.
We got 300 for my employees initially, and then the next week we got 5,000, and then last week we did not get any, and we're hoping to get 10 to 12,000 next week, but we put in our request to the city, but we'll find out on Friday.
I have been on Walgreens website for days trying to get, I'll say up till midnight, I'm trying to get on, I can't get on. There are no available vaccines. I have been listening to friends. I went on CBS and Mariano's. I've been through all the websites I can think of just to get an appointment to see if anything was available.
Persistence paid off. After weeks of trying, Diane Jastrom was finally able to roll up her sleeve for her first dose. Right next door, her husband did the same.
You get discouraged because you keep going on, you keep looking, and it's been, so many days you keep looking and looking and looking, and there's nothing. So excited. You have no idea.
We're doing the best we can to prioritize these groups, and the city is giving us the vaccines as they get them.
Across town at Rush University Medical Center, a packed waiting room.
Our vaccination clinic is 4 days a week right now, and we're averaging about 1,000 vaccinations a day.
Right now, the clinic is filled with patients who receive their general care at the medical center. For 66-year-old Diane, it was an easy process. She got an alert on MyChart and made the appointment.
They are coming in weekly, and that the dose allocation is variable. So we submit a weekly request based upon our capacity, and at the end of the week, we get confirmation on what we will receive.
For Alfredo Caraballo, a pastor in the city's southeast side, there's an even greater meaning behind the opportunity to get the vaccine.
For me, it's a great day. One, because in May I got COVID. I never want anybody to ever go through that again. And I never want to go through that again. And so that's one of the reasons why I want to get the COVID shot and encourage others to get it as well. Part of being a person of faith is also trusting in people and in the medical profession.
But right now, it's a matter of patience, just as it was in the early days of the pandemic when tests were in short supply. But we saw today more and more people are getting their shot at beating COVID-19. We do have resources online with links to various places for you to sign up. Back to you.
Nah.
The thing that drives me every
What
day
else we got there?
him.
Amari, because I'm very cognizant of this clock here. I want to get Reverend Ike and I want to get Brother Minister Khalid. All right, let's deal with this and then we'll call it out. Do these two and we'll call it a day.
No mystery God. Absolutely no mystery God. There is no God in the sky and there is no devil under the ground. Heaven is not in the sky and hell is not under the ground. Heaven and hell are conditions of the mind, states of existence and states of being. And so Jesus told us to stop looking for heaven in the sky. He said the kingdom of heaven is within you. And that we are the temples of the living God. That the living God lives in our temple, and he does not inhabit the sky, but he inhabits the higher realms of the heavens, of the realm of the secret innermost chambers of the subconscious chamber of the soul of man and woman. And this power bursts forth and emanates.
Nah. Why he looking for Reverend Ike? Understand this here. Those people you saw out there with that dope, you know what I'm saying? That was some serious hell. Addiction can bring a serious hell experience. but it might start off with what seemed like a
Presence of
heavenly
God
experience.
within.
All right, brother.
It is time for people to wake up to the power of God within. Because I find that many people are completely unconscious of the presence of God within themselves. And we have discovered in this ministry, here in these services as well as over television, that many people are just downright disturbed, and some are shocked when we say the presence of God is within you. I'll never forget a few Sundays ago as I was preaching and I said, God is in you, not in the sky. Well, there was one precious lady sitting in the audience that couldn't take it any longer. She jumped up from her seat and pointed up and began to shout, "No, God! No, God!" Many of you remember that. I said, now you see, there's a person who is asleep in religious doctrines and dogmas. Like many of us, she had been taught so long about God in the sky that the idea of God within her just blew her mind. And many people openly take the attitude, Reverend Ike, I don't know about this God in me business. This God in me business is just too much for me to accept. Why don't we just leave him in the sky? This is just too much for me. Well, you need to awake. You need to awaken to the fact that the power and presence of God are within you. You need to awaken to the fact that the mastermind of God is within you, and it will lead you to the fulfillment of the good which you desire.
Now, let me say this here. See, I like closing with that because you see, Reverend Ike and Brother Khaled are both in the afterlife. But the beauty of CAN TV in this day is that you really never have to die. Because there will be people like me that will have the guidance of the Creator and the ancestors to bring you forth and your message forth as an inspiration. Reverend Ike was way ahead of his time. He was talking that type of message years before all of you new generation creatures and you greedy, money-hungry pimps started your scam. He was telling you the truth. You was ashamed of him. You stood back. Brother Khaled, he was in the Nation of Islam, so you know how you felt about him. But they were telling you the same truth. And I'm here to tell you again right now in my day and time. Because I am one of those that was doing their day. And here I am after their day. And what you have to understand is this. The substance that we are experiencing in our family members' lives and the pandemic we are experiencing with the fear in our own lives, they are a burden. But you need to be able to go within yourself. And sometimes that ain't enough. Because a lot of big shot preachers done been buried or cremated already. Because they thought that they could handle it just by believing what they read. And sometimes you might need a vaccine. I ain't telling you that's what you need to do. I'm just saying. But you need to know that God is within you. You need to know that. You need to know that heaven is within your condition. Hell is within your condition. And that dope and other escape methods are truly addictions. So until next week, alafia, peace, and good health.